Okay, next, hips. Upper body still going to be involved though. So what I want you to do, right foot forward, ball in your right hand. As I step back with my right foot, I'm going to pass this to my left hand, like so. And then I'm going to reverse it, so I'm going to go left to right, and then right to left, left to right. Once I'm comfortable with that, so first off, just start off with a low range, particularly if you're tight, particularly if you're injured, nice low range. But the aim is to build that into a much bigger range. So we start here, and then eventually we want to be moving, deep lunges, deep reverse lunges, nice quick transition. So we're getting that acceleration and deceleration, we're getting that contracting, relaxing, we're getting that absorbing, releasing force. So there's a lot going on in that simple movement. Again, rhythm and coordination. So I'm going to switch over now. So left hand, left foot forward. As I step back with my left leg, I'm going to pass this to my right hand, like that. Same thing, nice low range, particularly if you're new to this, particularly if you are stiff and tight or rehabbing an injury. This is great for hips, knees and backs. Once I'm confident, that's when I can start to increase that range. Now, if you notice, there's a reason I've asked you to start like that, because when I'm doing that movement, I'm getting that coiling going on. So what I mean by that is this shoulder kind of wrapping towards that foot, and then vice versa. Like when we're running or walking, we get that kind of motion, that boom, 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 boom. That storing and releasing of energy across the whole chain. That's why I do it that way, because a lot of us, it's off, myself included. So I always make sure that my rehab drills kind of respect that movement and respect that pattern. And it might feel a bit weird at first, but the more you do it, the more rhythmic you're going to feel. And you should start to notice when you're like walking and running as well. So these are great for, again, they're great for anyone. They're great for, these are like movements that I would give anyone. I give them to like 70-year-old women, and I actually do. I was doing this yesterday with like a 70-odd-year-old lady who's recovering from a neck injury and kidney surgery. So they're great. And I also give them to like high-level athletes, because as you can see, it's dead easy to scale. So for your beginners, it's like here. I have someone on Walker doing this, right? So if she can do it, anyone can do it. But then I start to boom, 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 and I'll get like ultra runners in, I'll get high roxers in. They can't do that. No, they start learning how to do that, and all of a sudden they're like, man, my hips feel better. And then it starts to transition to the other things they're doing. Super simple, but super effective. Now, just for finish, if you're okay with that, what I then want you to start to do, so let's go right hand, right foot forward, boom. I want you to start stepping out, so I'm moving in multiple directions with it, and that's the advanced version. And once we're there,